diabetic retinopathy, and macular edema. This common eye disease is the leading cause of blindness in working-age adults and usually affects both eyes. Diabetic retinopathy is produced when high blood sugar damages the blood vessels on your retina. Damaged blood vessels leak fluid and blood, causing swelling in the retina or clogging of the blood vessels. It's much like stroke or heart attack, but it happens in your eye. So in response to this, your eye rush produces blood vessels which cause more damage, as I explained earlier. Now, what are the risk factors of diabetic retinopathy? Anyone with type 1, type 2, or gestational diabetes can develop diabetic retinopathy. The longer that you have diabetes, the more likely it is for you to develop diabetic retinopathy. Now, these factors increase your likelihood of developing diabetic retinopathy. 1. Increased blood sugar. 2. Increased blood pressure. 3. High cholesterol. 4. Smoking. And 5. Your race. On the average, you are more likely to get diabetic retinopathy within 5 years of being an insulin-dependent diabetic, or within 10 years if you are non-insulin dependent. Diabetic retinopathy has two main stages. The first is early or pre-proliferative. In the beginning, your blood vessels start to weaken and small bulges appear. You won't be able to detect it at this stage, but your eye doctor can. These bulges start to leak fluid and blood, and the retina around it starts to swell. If the most central part of your retina gets affected, we call that the macula, then your vision will become distorted and blurred. This is called macular edema. Macular edema is the most common cause of blindness among patients with diabetic retinopathy. About half of people with diabetic retinopathy will develop macular edema. The next stage is called the advanced stage or proliferative stage. By this time, your retina is already choking and running out of oxygen. It's gasping for breath. Your eye responds by rushing and mass producing small blood vessels all over your eye. We call this neovascularization. Now, this should be a good thing, but these rush blood vessels are pathologic. They're defective and they leak and contract all over. So we see bleeding in your retina, and some of it are even spilling out into the vitreous. They start slowly at first, just 1 or 2 small dots, then a couple more, and then more black dots floating until you see clumps, until you see flashes, and then your vision becomes darker. Obviously, those areas covered by the blood cannot see anymore, whether they are in the vitreous or in the retina. If there are a lot of bleeding, your vision may be completely blocked. But diabetic retinopathy just does not end there. Traction bands start forming and they pull on your retina a little at first, but then it gets stronger, it gets bigger, and it starts to tear your retina apart. So this is followed by more bleeding, creating more traction bands, creating more bleeding, and let's just say everything is destroyed. Well, let's just call it Armageddon. With that picture in mind, I want to encourage you to help us catch this disease early. You may not see any symptoms in the early stages. That is why it's very important to get a dilated eye exam to catch this problem very early when it can be treated more effectively. Symptoms of the advanced stage will include the following: blurry vision, dark floaters, flashes of light, trouble seeing colors, dark or empty areas in your vision, and finally, blindness. So, how do you avoid becoming just another statistic? Have your blood sugar monitored regularly, even if you feel fine. You should be more vigilant if you have relatives who have diabetes. The closer these relatives are to you, the more vigilant you should be. People do not die or get blind from diabetes. They die or become blind because of complications of diabetes. That means knowing that you have diabetes is only the beginning. Monitoring your kidneys, your heart, your nerves, and your eyes are just as important. Have your eyes examined at least once a year. It's basically the same reason why you have your teeth checked yearly. It's the same reason why you should have your blood exams done yearly. You should not wait until you already have problems in your eyes before you have it checked. Share with us in the comments for any questions that you may have. Have a great day.